Right now, more than 200 million Americans are under extreme heat. In Europe, over 1,300 people have already died from it in the past 2 weeks alone, and most of them had warning signs. Signs that were either missed, ignored, or misunderstood as something else. Heat stroke is a medical emergency. Once it begins, body temperature can rise to 106 degrees Fahrenheit within 10 to 15 minutes. At that point, you are looking at brain damage, organ failure, and death. The difference between survival and permanent damage comes down to one thing: recognizing the symptoms early enough to act. In this video, I am going to walk you through every heat stroke symptom in the exact order they appear, and tell you precisely what to do the moment you see each one. This information could save your life or someone else's today. Before the symptoms, let me explain what is actually happening inside the body. Heat stroke is defined clinically as a core body temperature above 40 degrees Celsius minus 104 degrees Fahrenheit, combined with central nervous system dysfunction. This is what separates heat stroke from heat exhaustion. The brain gets involved. When the body can no longer regulate its own temperature, a cascade begins. Inflammatory proteins called cytokines are released throughout the body. Multiple organ systems begin to fail simultaneously: the brain, the kidneys, the liver, the muscles, and the heart. This is not a heat cramp. This is not feeling faint in the sun. This is systemic organ failure unfolding in real time. There are two types: exertional heat stroke, which develops in young, healthy people after intense physical activity in heat, sometimes within hours, and classical heat stroke, which develops over days of exposure to high temperatures, most commonly in older adults, infants, and people with chronic illness. Both are medical emergencies. Both can kill. The symptoms are almost identical. The difference is how fast they arrive. The first and defining symptom: a core body temperature above 104 degrees Fahrenheit 40 degrees Celsius. This is the clinical threshold. Below this, the body is still fighting to regulate itself. Above it, that fight is being lost. Here is what is important to understand medically. Peripheral temperature measurements, the ones taken under the arm or in the mouth, can be significantly inaccurate during heat stroke because blood is being redirected away from the skin. Rectal temperature is the most reliable measurement in a heat stroke emergency. Now, in a real-world situation, most people do not have a rectal thermometer, so you use the next symptom as your guide. But if you do have any thermometer, and you are reading above 103 to 104 degrees Fahrenheit, act immediately. Do not wait for the temperature to climb higher. The next symptom is critical, and it is the one most people misread. In heat stroke, the skin is typically hot, flushed, and dry, not sweaty, dry. This is the opposite of what most people expect from a heat emergency. And it is the key clinical distinction from heat exhaustion. In heat exhaustion, the skin is pale, cool, and clammy because the body is still sweating. In heat stroke, sweating has stopped or is severely impaired. The body's primary cooling mechanism has failed. When you see a person who has been in extreme heat and their skin is hot, red, and dry, that is a red flag that the situation has moved beyond heat exhaustion into a genuine medical emergency. The absence of sweat does not mean they are comfortable. It means their cooling system has shut down. Note: in exertional heat stroke, the type that develops during physical activity, sweating may still be present. Do not use the absence of sweat as the only indicator. Use all symptoms together. Headache is one of the earliest warning symptoms of heat stroke, and one of the easiest to dismiss. Clinically, the headache from heat illness is caused by cerebral vasodilation, the blood vessels in the brain expanding in response to heat, combined with early dehydration reducing blood volume and pressure to the brain. Most people in a heat wave assume their headache is from the sun, from not drinking enough, or from general tiredness. They take paracetamol or ibuprofen and carry on. Nausea and vomiting appear early in the heat illness spectrum and are caused by the body diverting blood flow away from the digestive system to prioritize the skin and muscles in its attempt to cool down. As core temperature rises, the gastrointestinal tract is one of the first systems to be deprioritized. The result is nausea, an inability to tolerate food or drink, and in many cases vomiting. This creates a dangerous feedback loop. The body desperately needs fluids to support sweating and circulation. But the nausea prevents the person from drinking, and vomiting removes what little fluid remains. dehydration accelerates rapidly. One clinical point that is critical for bystanders: if a person is vomiting or is showing signs of altered consciousness, do not attempt to give them anything to drink. The risk of choking and aspiration, fluid entering the airway, is significant. Hydration at that point requires intravenous fluids in a hospital setting. As heat stroke progresses, the cardiovascular system comes under severe strain. The heart rate accelerates significantly, clinically called tachycardia. The body is attempting to pump blood faster to the skin surface to release heat, while simultaneously dealing with a falling blood volume from dehydration. The heart is working harder than it should with less fuel than it needs. Breathing also accelerates, tachypnea, as the body tries to release heat through the respiratory tract and compensate for falling blood pressure. In a person with pre-existing heart disease, this cardiovascular strain can directly trigger a heart attack. This is one of the primary reasons heat stroke disproportionately kills people with cardiovascular conditions. The heart is being pushed to its limit at the exact moment it is most vulnerable. A strong, rapid pulse combined with the other symptoms on this list is a clinical red flag. At this point, 911 should already have been called if it hasn't been. Dizziness and loss of coordination, medically called ataxia, signal that the brain is now being directly affected by the rising core temperature. The brain is one of the organs most sensitive to heat. As temperature climbs above 104 degrees Fahrenheit, neurological function begins to degrade. Spatial awareness fails, the person feels lightheaded, unsteady on their feet, and may stagger or stumble without warning. Ataxia is a significant clinical marker. It is one of the defining signs that separates heat exhaustion from heat stroke according to NIH clinical criteria. Heat exhaustion does not typically cause true neurological dysfunction. Heat stroke does. This is also the point at which falls and secondary injuries become a serious risk. A person in this state who is standing, especially an older adult or a child, is at real risk of falling and sustaining a head injury on top of an already critical medical situation. Confusion and altered mental status are the most important warning signs in the entire heat stroke picture, and the ones most often missed by bystanders who assume the person is just tired or dehydrated. Clinically, altered mental status in heat stroke includes confusion, disorientation, slurred speech, irrational or aggressive behavior, and in severe cases delirium. The person may not know where they are, may be unable to answer simple questions, may become agitated and combative, or may seem completely vacant and unresponsive. All of these presentations are the brain, your most vital organ, being cooked. Poor body temperature above 104 degrees Fahrenheit directly disrupts normal neural function. At 106 degrees Fahrenheit, the damage begins to become permanent. If a person who has been in extreme heat is confused, even mildly confused, treat it as a heat stroke emergency. Do not rationalize it. Do not assume they are drunk, overtired, or behaving oddly for another reason. Confusion plus heat exposure equals 911. No exceptions. Seizures are a direct consequence of severe neurological dysfunction caused by extreme hyperthermia, body temperature that has climbed to a level the brain can no longer tolerate. They occur because the electrical activity in the brain becomes dysregulated when neurons are exposed to temperatures beyond their functional range. Clinically, seizures in heat stroke patients indicate a critical emergency with a high mortality risk if cooling is not immediate and aggressive. What does a seizure look like in this context? The person loses consciousness. The body shakes uncontrollably, either in rhythmic convulsions or with stiffening of the limbs. The eyes may roll back. The person cannot respond. It typically lasts between 30 seconds and 2 minutes. If you witness a seizure in someone with heat exposure, do not restrain them. Do not put anything in their mouth. Do not try to hold them still. Your job is to protect them from injuring themselves on nearby objects and to call emergency services immediately if they are not already on the way. In severe heat stroke, multiple organ systems begin failing simultaneously, and the signs appear in ways that may not be immediately obvious. The kidneys are among the first to be damaged. Reduced or absent urine output, oliguria, indicates the kidneys are under severe stress. In some cases, the muscle breakdown caused by extreme heat triggers a condition called rhabdomyolysis, where muscle fibers rupture and release a protein called myoglobin into the bloodstream. This protein is directly toxic to the kidneys and can cause acute kidney failure within hours. The liver also begins to fail in severe cases, indicated by jaundice, a yellowing of the skin and eyes, appearing within 24 to 72 hours of a severe heat stroke episode. The lungs can develop acute respiratory distress syndrome. The heart can develop dangerous arrhythmias. I want to be direct. If a patient is showing organ failure signs alongside the neurological symptoms I have already described, this is an intensive care unit emergency, not a first aid situation. The first aid goal at this point is to cool aggressively, call emergency services, and keep the person alive until professional medical care arrives. Now let me bring the treatment together into a single clear protocol. What you do, in what order. The moment you suspect heat stroke. 1. Call 911 immediately. Do this first. Do not delay the call to begin cooling. Do both simultaneously if possible, but if you must choose, call first. Step 2. Move the person to a cool environment. Air conditioning is ideal. Shade is the minimum. Get them out of direct sun and heat immediately. Step 3. Remove outer clothing. Every layer removed allows more heat to escape from the skin surface. Step 4. Begin aggressive cooling. The most effective method available to you outside a hospital is cold water immersion. If you have a bathtub, a large container, a paddling pool, fill it with cold water and immerse the person. This is the same method emergency physicians use in hospital settings, and it works faster than any other non-invasive method. If immersion is not possible, apply ice packs directly to the neck, armpits, and groin. These are the areas where large blood vessels run close to the skin surface, and cooling them drops core temperature fastest. Simultaneously mist the skin with cool water and fan vigorously. Evaporative cooling adds a second mechanism working in parallel. Step 5. Monitor temperature and consciousness. The target is to reduce core temperature to 102 degrees Fahrenheit as quickly as possible. The longer the body remains above 104, the more severe the damage. Step 6. If the person is conscious and able to swallow without difficulty, offer slow sips of cool water or an electrolyte drink. Not caffeinated, not alcoholic, not ice cold. If there is any confusion, vomiting, or reduced consciousness, nothing by mouth. Step 7. If the person loses consciousness and stops breathing, begin CPR immediately. 30 chest compressions to rescue breaths. Continue until emergency services arrive. 3 things you must never do. Do not give aspirin or paracetamol. These can cause additional complications in heat stroke. Do not give alcohol or caffeine, and do not leave the person alone at any point. Before I close, I want to cover prevention, specifically who is most vulnerable right now, and what the medical evidence says about protecting them. The highest risk groups are older adults, particularly those over 65, living alone, without air conditioning. Heat-related deaths in people over 65 have increased by 68% over the past 2 decades. Older adults often have a reduced ability to feel thirst even when severely dehydrated, and their temperature regulation mechanisms are less efficient. Infants and young children are the second highest risk group. Their bodies heat up faster, they cannot communicate symptoms reliably, and they depend entirely on caregivers to recognize warning signs. People with cardiovascular disease, diabetes, kidney disease, respiratory conditions, and obesity face significantly elevated risk because heat stroke directly stresses the systems already compromised by these conditions. People taking certain medications face additional risk. Antihistamines, diuretics, beta blockers, antipsychotics, and anticholinergic medications all impair the body's ability to regulate temperature or increase the rate of fluid loss. If you or a family member takes any of these medications, speak to your physician or pharmacist about heat risk before going outdoors during a heat wave. The evidence-based prevention steps are straightforward. Stay in air-conditioned environments during peak heat hours, typically 11 a.m. to 4 p.m. Drink water before you feel thirsty. Thirst is already a sign of early dehydration. Wear lightweight, light-colored, loose-fitting clothing. Never leave a child or pet in a parked car, even for minutes. Check on elderly neighbors and relatives daily during a heat wave. And if you must work or exercise outdoors, acclimatize gradually, take frequent shade breaks, and hydrate with electrolyte drinks, not just water.